Hey everyone, time for a trigger warning. If you are afraid of talking about flex spines, hang on. So one of the things that I want to clear up, and maybe it's time to have a conversation or a different language change around this, is that flexion happens all the time in the spine. We know that. But most of the injuries or tweaks or sprains or dysfunction or pain generation that we see around what we think is a rounded back is not a rounded back. It's an extension moment out of a rounded back. It's actually an extension injury, not a flexion injury. So some really good research is showing that, hey, there's a lot of normative flexion that happens. So look, if you are deadlifting, Diane gets into a good deadlift position here, right? Or a clean position, and she starts to push on the floor and pull on that bar. Go ahead and just do a little bit. There is a large flexion moment on her back. This bar is trying to basically round her spine, and her job is to try to use her technique, her musculature, her fascia, her connective tissue, her bony structures to resist that so that she can move and finish the movement, right? That makes sense. Now look, that has a flexion moment on it. Doesn't matter. This is irrefutable. This is science. Now go ahead, and what we want you to know here is that in this position, we're trying to minimize the amount of change or delta in this spinal position. Now go ahead and round in this position. Still, the same amount of flexion loading is happening on the spine, but now the spine is in a flexed position. You see the difference? So there's always flexion moments on the spine. We actually train flexion. It doesn't matter what position you're in. We train flexion no matter what. That's not where I'm trying to be cute. So one of the problems that we have with a rounded back deadlift, and real quick, stand back up, Di. You and I have been in the gym together for 15 years. In the course of 15 years of running everyone through the gym, have you ever seen a rounded back deadlift?
I mean, is that a trick question?
Have you ever seen someone not round their back picking dumbbells up off the ground?
That's a trick question.
Trick question, of course.
All the time.
So we know from rowing, from being an athlete, that flexion matters, right? And we actually see very few tweaks people rounding. In fact, we use that rounding to notice that, hey, we think you've exceeded your capacity in the gym. So, or capacity on the load, or like, hey, your technique's breaking down. What we don't see is, pooh, spines blow up, right? So this language of flexion fear, or don't round your back because it's injury, we actually in the gym and training environment feel like that's a red herring. Let me say that again. That's a red herring. So what we see as a problem actually is when people are trying to finish a deadlifting movement out of a flexed spine position. Because as we've talked about before, as Diane pulls on the bar, loses her position for whatever reason, she actually can't stand up from this position. And what you'll see is that people's knees come forward, they hang, they try to change the moment arm and the mechanics to actually finish this movement. And one of the reasons that we think people round is actually they're trying to solve a mechanical problem. They're way over and they can't actually create any force in this position. Knees have shot back. This changes the line of force and then they can push. So we often see rounding as a technical solution to a poor organized setup, right? But at the top of her deadlift, when she goes from that round, go ahead and just pretend like you're almost finishing the push and you're pulling. She actually can't finish in this position. We see this happen all the time. She almost stands up, but she's still here not getting credit for the deadlift, right? So remember, we see flexion happen all the time in pulling. So what happens here is that Diane no longer can finish the motion because mechanically it's impossible to do that. So what we see is that Diana's pelvis comes into extension. And so we know that this anterior pelvic tilt is an extension movement. And to solve this mechanical problem, Diane gets to the top and then brings her pelvis forward into extension. And that's where we see most of the gnarliness in the world people. Every once in a while someone's pulling and they're like, ping. Maybe you see that on the internet. Lots of rounded back deadlifts. We teach deadlifting to everyone. It takes a second to get the skills. But what we really see it go wrong is that we go here and then I translate through that translation of that movement when the top is fixed and now I'm moving the lower segments into extension. That is harder to buffer. So if we're gonna be clear about the mechanics, and I don't know why we're not more clear about this, we have to identify a lot of the injuries, tweaks, et cetera, around deadlifting or pulling to attribute them to extension loading, an extension moment on the spine. We have a few segments that are trying to get it done. I'm locked through, I try to slam my lumbar underneath, sneak underneath that so that I can finish up top. So if you come over to the skeleton, so you can see what we're talking about, we all have a lumbar curve here, right? That's normal. We're trying to maintain this because these positions of our normal curvatures in mid-range give us a lot of axial load. We can handle a ton of load through here. We get the lats on, the thoracic dorsifascia, all the musculature, hip, et cetera, right? All the mechanisms by creating stability. But again, when we round through these systems, right, what we see is that there's very little, most of that is happening mid-thoracic where we see this. It's not tunnel lumbar, but whatever, it's all variable. But it's when we get stuck here, can no longer have the mechanics to extend the thoracic spine, we sneak the lumbar spine underneath it. And that shearing forward is an extension moment here, which really does expose the mechanics of the lumbar to a lot of forces that are hard to buffer. That may be, I get away with that for a long time, and then maybe one day I don't. Again, we think this is poor technique. That's our main thing. It's a dead end. You can no longer lift. You can't translate energy. You can't breathe. You can't stabilize. But we want to take a moment and reclassify these flexion injuries, which have started in flexion, where the pelvis has moved into extension, as extension tweaks. This is not, I'm not trying to be cute here. I'm trying to say, hey, let's really understand what's happening so that we can get beyond this flexion is safe dogma. Because flexion happens all the time. It is safe. We're really capable of handling large loads of flexion. We're not capable of is having gigantic extension moments through a few of our segments trying to solve a flexion dead end. Hopefully that helps.